Question 131. During shift report, the nurse learns that an older female client is unable to maintain continence after she senses the urge to vomit and becomes incontinent on the way to the bathroom. Which nursing diagnosis is most appropriate? A. Stress urinary incontinence. B. Relaxed urinary incontinence. C. Functional urinary incontinence. D. Urge urinary incontinence. Answer D. Explanation. The key phrase is the urge to void option. One occurs when the client coughs, sneezes, or jars the body, resulting in accidental loss of urine. Option 2 occurs with involuntary loss of urine at somewhat predictable intervals when a specific bladder volume is reached. Option 3 is involuntary loss of urine related to impaired function. Question 132. A female client has a urinary tract infection. Which teaching points by the nurse should be helpful to the client? Select all that apply. A. Limit fluids to avoid the burning sensation or urination. B. Review symptoms of UTI with the client. C. Wipe the perineal area from back to front. D. Wear cotton undercloths. E. Take baths rather than showers. Answer B and D. Explanation. Option 2 validates the diagnosis. Cotton underwear promotes appropriate exposure to air, resulting in decreased bacterial growth. Increased fluids decrease concentration and irritation. The client should wipe the perineal area from front to back to prevent spread of bacteria from the rectal area to a urethra. Showers reduce exposure to area of bacteria. Question 133. The nurse will need to assess the client's performance of clean intermittent self-catheterization (CISC) for clients with which urinary diversion? A. Ileoconduit. B. Cock pouch. C. Nail bladder. D. Vesicostomy. Answer B. Explanation. The ileoconduit and vesicostomy are incontinent urinary diversions, and clients are required to use an external ostomy appliance to contain the urine. Clients with a nail bladder can control their voiding. Question 134. Which focus is the nurse most likely to treat for clients with a flaccid bladder? A. Habit training, attempt voiding at specific time periods. B. Bladder training, delay voiding according to a pre-scheduled timetable. C. Grits maneuver, apply gentle manual pressure to the lower abdomen. D. Kegel exercises, contract the pelvic muscles. Answer C. Explanation. Because the bladder muscles will not contract to increase the intra-bladder pressure to promote urination, the process is initiated manually. Options 1, 2, and 4 to promote continence bladder contractions are required for habit training, bladder training, and increasing the tone of the pelvic muscles. Question 135. Which of the following behaviors indicates that the client on a bladder training program has met the expected outcomes? Select all that apply. A. Voins each time there is an urge. B. Practices slow, deep breathing until the urge decreases. C. Uses adult diapers for just in case. D. Drinks citrus juices and carbonated beverages. E. Performs pelvic muscle exercises. Answer B and E. Explanation. It is important for the client to inhibit the urge to void sensation when a premature urge is experienced. Some clients may need diapers. That is not the best indicator of a successful program. Citrus juices may irritate the bladder. Carbonated beverages increase diuresis and the risk of incontinence. Question 136. A nurse has identified that the patient has overflow incontinence. What is the major factor that contributes to this clinical manifestation? A. Coughing. B. Mobility deficits. C. Prostate enlargement. D. Urinary tract infection. Answer C. Explanation. An enlarged prostate compresses the urethra and interferes with the outflow of urine, resulting in urinary retention. With urinary retention, the pressure within the bladder builds until the external urethral sphincter temporarily opens to allow a small volume of urine to escape. Coughing, which raises the intra-abdominal pressure, is related to stress incontinence, not overflow incontinence. Mobility deficits such as spinal cord injuries are related to reflex incontinence, not overflow incontinence. Urinary tract infections are related to urge incontinence, not overflow incontinence. Question 137. A nurse must measure the intake and output INO for a patient who has a urinary retention catheter. Which equipment is most appropriate to use to accurately measure urine output from a urinary retention catheter? A. Urinal. B. Graduate. C. Large syringe. D. Urine collection bag. Answer B. Explanation. A graduate is a collection container with volume markings, usually at 25 mm increments, that promote accurate measurements of urine volume. Although urinals have volume markings on the side, usually they occur at 100 mm increments that do not promote accurate measurements. Option 3 is impractical. A large syringe is used to obtain a sterile specimen from a retention catheter. A urine collection bag is flexible and balloons outwards as urine collects. In addition, the volume markings are 100 increments that do not promote accurate measurements. Question 138. A patient's urine is cloudy, is amber, and has an unpleasant odor. What problem may this information indicate that requires the nurse to make a focus assessment? A. Urinary retention. B. Urinary tract infection. C. Ketone bodies in the urine. D. High urinary calcium level. Answer B. Explanation. The urine appears concentrated and cloudy because of the presence of bacteria, white blood cells, and red blood cells. The unpleasant odor is caused by buzz in the urine. These clinical manifestations do not reflect urinary retention. Urinary retention is evidenced by suprapubic distension and lack of voiding or small frequent voiding. These clinical manifestations do not reflect ketone bodies in the urine. A reagent strip dipped in urine will measure the presence of ketone bodies. These clinical manifestations do not reflect excessive calcium in the urine. Urine calcium levels are measured by assessing a 24-hour urine specimen. Question 139. A nurse is caring for a debilitated female patient with nocturia. Which nursing intervention is the priority when planning to meet this patient's needs? A. Encouraging the use of bladder training exercises. B. Providing assistance with toileting every 4 hours. C. Positioning a bedside commode near the bed. D. Teaching the avoidance of fluid after 5 p.m. Answer C. Explanation. The use of a commode requires less energy than using a bedpan and is safer than walking to the bathroom. Sitting on the commode uses gravity to empty the bladder fully and thus prevent urinary stasis. Although option 1 should be done, it is not the priority. Option 2 may be too often or not often enough for the patient. Care should be individualized for the patient. Fluids may be decreased during the last 2 hours before bedtime, but they should not be avoided completely after 5 5 p.m. Some fluid intake is necessary for adequate renal perfusion. Question 140. A practitioner uses a urine specimen for control and sensitivity via a straight catheter for a patient. What should the nurse do when collecting this urine specimen? A. Use a sterile specimen container. B. Collect urine from the catheter port. C. Inflate the balloon with 10 mm of sterile water. D. Have the patient void before collecting the specimen. Answer A. Explanation. The counter attempts to identify the microorganisms present in the urine, and a sensitivity study identifies the antibiotics that are effective against the isolated microorganisms. A sterile specimen container is used to prevent contamination of the specimen by the microorganisms outside the body. The urine from straight catheter flows directly into the specimen container. Collecting a urine specimen from a catheter port is necessary when the patient has a urinary retention catheter. A straight catheter has a single lumen for draining urine from the bladder. A straight catheter does not remain in the bladder and therefore does not have a second lumen for water to be inserted into a balloon. This may result in no urine left in the bladder for the straight catheter to collect. A minimum of 3 mm of urine is necessary for a specimen for urine control and sensitivity. Thank you for watching.